Have you been feeling down, sad, blue? If so, you may be experiencing depression. Depression affects not only you, but also those who care about you. So what is depression? Well, there are three types of depression: major depression, dystemic disorder, and minor depression. Major depression, also known as clinical depression, is a type of depression that makes it difficult to work, study, sleep, eat, and enjoy your friends and activities. For some people, this type of depression only occurs once in a lifetime, but for others, it can happen multiple times. It's not uncommon for there not to be a family history of depression, and depression can often skip generations. This type of major depression is disabling and can prevent a person from functioning normally. The next type of depression, dystemic disorder, is characterized by long-term symptoms that aren't necessarily severe enough to be disabling like major depression, but they can prevent you from feeling well and can prevent normal function. A person with dystemic disorder may experience episodes of major depression during their lifetime. The third type of depression, minor depression, is characterized by having mild symptoms for 2 weeks or longer that don't necessarily meet the criteria for major depression, but without treatment, minor depression can develop into major depression. Now that you understand the three types of depression, let's talk about what causes depression. Depression may be caused by genetic, biological, environmental, and psychological factors. Depressive illnesses are disorders of the brain. When looking at a brain image, the brains of people with depression tend to look different than those that don't have depression. The parts of the brain that control mood, thinking, sleep, appetite, and behavior will appear differently on a brain scan. It's important to note, though, that a brain image does not reveal why depression occurs and is not typically used when diagnosing depression. There is some evidence that suggests that depression can run in the family, but it's not uncommon for people to experience depression and have had no family history whatsoever. Some research shows that the risk for depression results from the influence of several genes working together with environmental or other factors. These factors are things such as trauma, the loss of a loved one, a difficult relationship, or stressful situations, and these things may trigger depression. Other episodes of depression can occur without an obvious trigger. So now you understand the three types of depression and that it's a chemical imbalance in the brain. So let's take a look at the signs and symptoms, what to look for. The first thing that you'll notice is a feeling of fatigue or a general loss of energy, and this would occur almost every day. The second thing are feelings of worthlessness or guilt about something, and you would experience these feelings again almost every day. The next thing that you may notice is that your concentration is impaired, and you may experience some indecisiveness. Another thing to look for, insomnia. You may have trouble sleeping, or you may experience hypersomnia, which is excessive sleeping. Again, this would occur almost every day. You may also notice a diminished interest or pleasure in almost every activity, and this would occur, again, every day. There may also be some feelings of being slowed down or restlessness. There may also be recurring thoughts of suicide or death. A significant weight loss or gain is not uncommon. Some people either feed their depression or can't be bothered to get off the couch and eat. In men, the symptoms may be slightly different and can also include irritability, anger, or drug and alcohol abuse. Men tend to repress feelings of depression, and in turn, this can cause inward and outward violent behavior and may result in an increase in illness, suicide, and homicide. So who is at risk for depression? According to the National Institute of Mental Health, major depression affects about 7% of the U.S. population over the age of 18. Between 20 and 25% of adults may suffer an episode of major depression at some point in their lifetime. Major depression is often undiagnosed. It's suspected that many more people suffer from depression at some point in their lives. Women tend to be diagnosed twice as often as men, and this risk is increased by changes that occur during puberty, menstruation, pregnancy, miscarriage, and menopause. Depression in men is significantly underreported since men are less likely to seek help and less likely to talk about an experience that they believe is depression. So what can you do if you suspect that you have depression? The first thing is not to be afraid to ask for help. Seek medical attention, either from a doctor or from a mental health specialist. There are medications that have side effects that can appear to be depression, but a doctor can rule out whether this is the case for you by performing a simple physical exam, conducting an interview with you, and doing some lab tests. Your family doctor may refer you to a mental health professional who will discuss your family history and any other mental disorders and get a complete history of your symptoms. The most common treatments for depression are medication and psychotherapy. Antidepressants are medications that work on the chemicals in your brain that are called neurotransmitters. Although it's unsure exactly how the chemicals work, they have been found to regulate the mood. Newer antidepressants that have been introduced have fewer side effects than some of the older products on the market. The most common side effects of antidepressants are headaches, nausea, jitters, and insomnia when people first start to take them. Once you start taking antidepressants, it will take about 4 to 6 weeks for them to have a full effect. And the medication should be continued even if you start to feel better. This will help prevent the depression from returning. So I hope that you now understand what depression is, the 3 types, what can cause it, and what to look for and what to do about it if you do feel like that's what you are suffering from. I personally have been suffering from depression on and off for a few years, and depression really does hurt. You're not less of a person or anything like that because you have this medical disorder. Depression is just that, a medical disorder. Many people have to seek help for their depression and have to take medication for their depression. I know that I am not alone in my battle against depression, and I will be getting help for mine. And my hope for the future is to live my best life depression-free. How about you?